morning, I'm Rose Lee. Summer is gone and fall is here with cooler temps and colorful leaves. Think of the fall season as a fresh start to new healthy habits. According to the U.S. Census for Disease Control and Prevention, the nation spends $124 billion on costs related to dental care each year. Those Florida Medicare beneficiaries with Medicare Advantage plans expect nothing but quality care. And it's that time of year to review your healthcare plans to ensure you stay healthy in 2024. All this when we return. As we age, one of the most important aspects of our life is finding a doctor we trust that will work with us to achieve positive healthcare outcomes. A study published in the American Medical Association's JAMA network compared different types of Medicare plans. The result? One type led to significantly fewer hospital stays. Joining us to discuss the study is family medicine specialist with Optum, Dr. Rajay Sudath. Good morning, doctor.
Good morning. Thank you so much for having me on.
My pleasure. We love your energy and it's getting us all revved up this morning. Share with our viewers some of the findings from this study.
So the key finding is that nearly 1 in 5 people who were over the age of 65 who were enrolled in a Medicare Advantage plan where the doctors were performing value-based care compared to the regular fee-for-service Medicare plans had less likely to be hospitalized.
The Medicare Advantage data consisted of over 300,000 patient sample of Medicare Advantage beneficiaries residing in 6 states: Arizona, California, Florida, Nevada, Texas, and Utah. Was there a specific age group of patients, men and women, from Florida that were included in the study?
Yes, so the age group is going to be your Medicare age group. So 65 to 85 were the age groups that were studied. And actually, we're quite proud for having some of our patients who received value-based care at Optum and WellMed that were included in that study.
So what areas in the state of Florida did they pull this group that was studied?
So I am actually in Tampa. So there's Tampa, Treasure Coast, South Florida. We have Optum and WellMed and Healthcare Partners in quite a few areas in Florida.
Okay, great. So what were the different treatment methods that were studied?
So the major method differences is the Medicare Advantage model, which is value-based, and traditional Medicare, which is fee-for-service. We say it's traditional because that's typically how doctors are reimbursed. You know, you're sick, you go to the doctor, they get paid. So your doctor is basically getting paid as long as you stay sick. So that model mostly incentivizes their doctor to see as many patients as possible, to order as many tests as possible. Contrast that with the value-based care, the Medicare Advantage model. In that system, your doctor is getting paid when you're healthier. We are trying to keep our patients out of the hospital. We're trying to diagnose our patients before their disease flares. We're trying to diagnose our patients before their disease gets worse. So that is typically done by seeing our patients more frequently and making sure that we're having continuity of care.
Most patients do not understand all of the requirements their primary care doctor has to follow and meet as a Medicare provider. Their doctor's goal is to practice the best medicine to make sure their patient is in optimum health. Because if he or she is not healthier and waits to see their doctor until they find the time to check in to their local emergency room to receive some kind of medical attention for what the doctor could possibly even provide in an office visit, their doctor is penalized, correct?
Absolutely, absolutely. It's one of the things I tell patients. I don't make money when you're sick. I make money when you're healthy, and it's a simple statement, and it's very there's a myriad of ways in which you're exactly right. We get penalized. So if a person is a diabetic and their diabetes is not well controlled, for your viewers who have diabetes, the A1C, if that A1C is above 9, that's a penalization, because a person who has uncontrolled diabetes has a higher risk of heart attacks, has a higher risk of strokes, has a higher risk of having an amputation, has a higher risk of kidney disease and going on dialysis. So all of those things that that affect your health, that can make you more sick, that can change your life in irreparable ways, we are graded, and our financial gain is based on how well are we preventing those bad outcomes.
And that is very important to communicate to our viewers, that it is the truth about practicing medicine and how a doctor can bill an insurance claim and get paid for the medical service they provide. The best outcome is when a doctor and their patient benefit from good medical practices to keep a patient healthy. What are some of the benefits offered to Medicare Advantage patients that our viewers should be thinking about before making decisions about their Medicare coverage?
So the major one, I would say, is continuity of care. Your Medicare Advantage plan is really focused on continuity of care and building those relationships, those close relationships. The first relationship is going to be between your provider and your doctor. If your viewers are already on a Medicare Advantage plan, they see their doctors frequently. Your doctor wants to know what's going on. He wants to know how you're feeling. If you're not feeling well, is this medicine making you feel bad? And so you don't want to take the medicine. We want to know that very early on, and so we want to know that frequently. We want to see our patients frequently. Additionally, with your referrals, with your imaging, with your lab results, we are incentivized to make sure all of those things are happening smoothly. One of the mottos on Optum and WellMed is right patient, right care, right place, right time. And I think that really speaks to volumes of the value model versus the fee-for-service model. Because the fee-for-service model is, well, go and get this done. Hope you don't die.
Wow, that's sad but true. All right, doctor, there are higher incidents of chronic conditions such as diabetes, COPD, among people of color in the community. How does this care model address the disparity?
So it actually addresses it very well. In the study, it showed that patients who have COPD and asthma were 44% less likely to have a hospital admission due to those diseases. And primarily that has to do with, again, continuity of care and access to care. Communities that are minorities or have been marginalized often have to worry about, am I going to be able to see my doctor? It's access to care for multiple different reasons. If you have to worry about, am I going to pay rent or am I going to go and see my doctor this month, that's a fairly large socioeconomic barrier. In most Medicare Advantage plans, it's a zero copay to see your primary care doctor. So like I said, if I need to see you once a month, if I need to see you once a week, I have the freedom to do that, to see patients who need that care, that extra care. And making sure that you're on a plan or you're on a insurance plan that allows for that, that's going to meet your needs and allow for that continuity of care. Medicare Advantage is a wonderful option for that.
All right, doctor, tell us where our viewers can get more information.
So they can actually go to the website carewithresults.com, or if there is a local Optum, WellMed, or Healthcare Partners office near you, our staff in there can help you walk through the journey together.
Thank you so much, Dr. Sudath, for joining us this morning to share the important findings from the study to keep Medicare Advantage patients healthier.
Thank you so much.
Mentoring opens doors for students and job seekers with disabilities. Open the door to an all-inclusive workplace. Watch the upcoming episodes of Disability Mentoring and get involved in your community. Be a mentor. Close to 5 million people are enrolled in Medicare in Florida. That's nearly 23% of Florida's population. And there are also more than half of those Medicare beneficiaries who choose Medicare Advantage plans. There's lots to know about choosing a plan to meet your needs, and now is the time for Medicare beneficiaries to start doing their homework to make their Medicare choice for 2024. Joining us this morning to better inform you to make the right choice is Stephen Ruiz, the Regional President for CarePlus Health Plans, a Medicare Advantage plan here in Florida. Good morning, Stephen.
Hi, how are you doing?
Stephen, you were born and raised right here in South Florida, so you understand the need of those who receive Medicare benefits in our community. Let's start with the timing of Medicare annual enrollment period for 2024. When does it begin and when does it end this year?
It starts on October 15th and it runs through December 7th. This is the time of the year where you have the ability to select Original Medicare with a prescription drug plan, or you can opt to select the Medicare Advantage plan with coverage that would begin on January 1st.
All right, so for many people who don't understand insurance benefits, that there's different plans that are offered. Explain the difference between Original Medicare and Medicare Advantage.
There's a few differences. With Original Medicare, you're covered for hospital stays and doctor office visits, but you do have to meet a deductible, and then you're typically responsible for 20% of the cost. Original Medicare also does not cover Part D prescription drug coverage, which means you have to purchase a standalone prescription drug plan. Medicare Advantage plans are offered by private insurers like CarePlus. Medicare Advantage plans cover hospital stays, emergency care, doctor office visits, and often Part D prescription drug coverage, plus additional benefits, all wrapped in under one plan. Unlike Original Medicare, Medicare Advantage plans have a yearly cap on your out-of-pocket expenses.
Now that includes specialists as well, right?
It does include specialists, yes.
Stephen, as you've seen, the rise in the cost of living is affecting all Floridians. So what is important to keep in mind when choosing a Medicare Advantage plan to stay on budget?
There's several things that you want to consider. You're going to want to take a look at your medical expenses for the past year and think about your budget and your healthcare needs for the coming year. Take a look at monthly premiums, deductibles, and co-pays for hospital stays and doctor visits, plus pay attention to what the annual maximum out-of-pocket costs are. You're going to want to consider whether or not you qualify for any state or federal financial assistance programs, which could help you qualify for reduced costs on your covered prescription drugs. CarePlus can actually help you apply for a variety of financial assistance programs. And a lot of the times people qualify for these programs and they don't even know it.
Choosing a Medicare Advantage plan can be an overwhelming task. What do you suggest to start the process of choosing a Medicare Advantage plan to meet someone's specific medical needs? Because we are all different. One patient may be a diabetic, another could have a heart condition or COPD, or others can have severe medical issues.
Yeah, there's a lot of things that you want to consider. The first thing you want to take a look at is probably what medications you take regularly. It's probably a good idea to make a list of those medications and research that list to make sure that the Medicare prescription drug plan covers them. You also want to think about any procedures that you might need in 2024 and which doctors and specialists you may need to see. You want to ask whether or not your preferred physicians and hospitals are included in the plan's network. And if you're managing a chronic condition such as diabetes or heart disease, there are actually Medicare Advantage plans that are designed specifically for those qualifying conditions.
Stephen, what happens when a person enrolled in a Medicare Advantage plan and they are going to move from Dade County to Broward or Palm Beach County or another area of Florida? Do the costs of the plan stay the same throughout the year?
It depends. The plan that you select does need to be available in the county which you live in. So when an enrollee selects a plan, the plan needs to be available in the county in which they permanently reside. There are some plans which are available in multiple counties, and there are other plans which are available only in that specific county. If a member moves from one service area to another, they do need to make sure that the plan that they're in is the same in that new service area, or it's possible that they may need to switch a plan that's available in the new service area.
Okay, Stephen, tell us where our viewers can find more information on Medicare Advantage.
There's a couple different places. You can go to Medicare.gov or you can call Medicare directly at 1-800-MEDICARE. To learn specifically about Care Plus, you can go to careplushealthplans.com or you can call a licensed Care Plus sales agent for one-on-one help answering any questions that you may have.
Thank you so much, Stephen, for joining us this morning with information on how to choose the right healthcare plan to meet your needs in 2024.
Thank you so much. It was great.
Proactive prevention of disease is a function of both the primary care physician and the individual working together to ensure the individual stays healthy and has a good quality of life. Also, to identify the beginning of a disease, example, cancer, diabetes, heart disease. Early detection increases the chances of a complete cure or a maintenance program for the individual patient. To learn more on how to achieve a greater quality of health through preventive medicine, contact us at Infinity Healthcare Group in Broward at 954-586-8058. And please remember, January 1st is coming. You need to schedule your annual wellness exam. It is so important. It is the baseline of your health.
Everything costs more today, including necessary dental care. A recent survey shows rising out-of-pocket costs are preventing patients from accessing important dental care they need. 58% of those surveyed expressed that dental care is not affordable. And for those living without dental insurance, that number rose to 75%. The results found dental care for average adults ages 20 to 79 can cost $51,000 to $95,000 over a lifetime, which includes routine care and does not cover dental implants, orthodontia, or complex procedures that each cost tens of thousands of dollars. Here, with advice on how we can plan ahead and offer resources to better manage dental costs, is Bobby Rebel, a certified financial planner and founder and CEO of Financial Wellness Strategies. Good morning, Bobby.
Thank you so much for having me. And thank you, by the way, for covering such an important topic. You really illustrated in your introduction how important it is for all of us to be paying attention.
And here in Florida, even more so, because there's about 6 million Floridians who live in a dental desert. That is Florida counties without enough dental providers to serve their residents, who live without even basic dental care. And less than 5% of Florida dentists work in publicly funded dental offices, leaving the majority to work in private practice. So Bobby, share with our viewers some key findings from the survey respondents and how they deal with dental expenses.
Well, thank you so much for that. It is true. So the study is the Synchrony Dental Lifetime of Care study, and it did have a number of very compelling findings. You highlighted some of the most alarming ones right in your introduction, so thank you for that. It's also important to focus on the fact that people aren't necessarily getting the dental care that they need, not only for the reasons that you cited. I mean, it's really alarming to hear about the dental deserts down in Florida, but also because they simply, are in denial. They simply will put it off because of the cost of care. So for example, more than 90% of people, more than 90%, Rosalie, will put off general dental wellness because they're afraid of the costs. More than 80% will put off emergency dental care because they're afraid of the costs. And then you add to that the unique situation in Florida, and it is a recipe for disaster. So I think it's really important that we are getting ahead of this issue today.
Yes, and our population continues to grow, and we need to find a motivation for students to rethink what they're looking at as far as their academic studies and their career fields, and take a greater look at dentistry.
Yeah.
Sounds like that could be a benefit for all Floridians. So according to the U.S. Census for Disease Control and Prevention, the nation spends $124 billion on costs related to dental care each year. On average, 34 million school hours and $45 billion in productivity are lost each year as a result of dental emergencies requiring unplanned care. And nearly 1 in 5 adults reported that oral disease affected their appearance and hampered their ability to get work. Bobby, with these kind of costs being a barrier to dental care, what can people do to better plan and prepare for future dental care expenses?
You are right on target. It's all about plan and prepare, just like you said. So let's plan. So for example, focus on emergency funds. We sort of throw that term out there and we kind of say, oh, 3 to 6 months emergency fund, all the things. So we think about it as something for when we lose our job, but we don't think about it for what you're pointing out so acutely, which is emergency care for health and wellness, and specifically for dental care, which we know affects everything. You talk about our appearance, it also affects our general physical health, our mental health, our emotional well-being. So set up an emergency fund that is dedicated to your dental care. And the great thing these days is that you can put money in a money market account or a high yield savings account, both of which can be provided by Synchrony. And you can get a really good return. I mean, we always think, oh, we're not going to get that much return in a savings account. Well, these days, thanks to those high interest rates, which we don't like in most cases, we do like them when it comes to keeping our money liquid and available in things like money markets. You can get a pretty good return. I also want people to pay attention to money that they can use that's pre-tax money or even free money. Where do you get the free money? Well, look at your employer benefits. For many people, this is open enrollment season coming up this fall, and you can put money in something called a health savings account, which is money that you're going to put in pre-tax. You can use the pre-tax money to pay for things like dental expenses in many cases. And I want people to proactively ask, find out, talk to your HR person. Many companies will match hundreds of dollars and put that into your health savings account in addition to what you're putting in, just to incentivize you. That is free money. And also when it comes to flexible savings accounts, flexible spending accounts, I should say, FSAs is the acronym, you can get pre-tax money that you put in there more than $3,000 a year. You do it automated through your paycheck. I promise it'll be a lot less painful than you think. And then that money is there when you need it for the dental care. The final thing I want to mention, though, in terms of being prepared, is if you get to the point where you do need dental care, and it needs to be done. Dental care is really important to do at the right time, not to put it off. You want to have other tools in your arsenal. So one thing you can have is a dedicated health and wellness credit card like Care Credit, where you can get promotional financing options, like, for example, and this is where we talk about interest rates on the other side, where we don't like the higher interest rates. You can get, if you qualify, deferred interest. You can also, if you qualify, spread out those payments to be a lot more budget friendly over anything from 6 months to 60 months and make it fit your needs so that you get the dental care for you and your family that you need at the right time. I don't want anyone putting off dental care for financial reasons. It's so important.
In this survey, 92% of respondents say they will consider holding off on general dental care because of the costs. Do some of these respondents realize the repercussions from putting off dental care that can actually affect their overall health care?
Yeah, well, we didn't drill down that much, but I can tell you that it does get more expensive. It is very painful, both physically painful, because we know that cavity can turn into a root canal, can turn into a crown, and so on. And that's just a lot more expensive for anyone. We also know it gets more expensive financially because, look, a cavity is not cheap, but let me tell you, that root canal is going to be a lot more money. So it is something that people really need to pay attention to and really tackle in the moment. You do not want to put it off.
I've heard some people say they fear walking into a dentist's office, and I tell them, if I was you, I would be fearful of the results of not walking into the dentist's office.
Yeah.
That's something to think about now, isn't it?
You are so on target.
So, Bobby, with the cost of dental care being a barrier for many people, you talked about the different options. If someone has a very small budget, what can they do to better plan and prepare for possible dental costs as they go through the calendar year?
Yeah, I love automation and preparation. So we do this a lot. We hear about, oh, saving for a vacation, saving up for your wedding, saving up for the holidays, right? Do the same thing with dental care, but even more, because a lot of those things have much more flexible costs. You can decide to spend a little bit more or less on presents for your family over the holidays, but when it comes to dental care, it kind of is what it is. And so you want to make sure you automatically put money in, in, as I mentioned, a money market fund or a high yield savings account, you're going to get a nice return while you're doing it, which is really compelling. But automate everything that you can. Any bank, pretty much any bank, is going to be able to do that for you. Set up a separate account, dedicated, and you're going to feel the progress because you'll see that number getting bigger every month, and you're going to feel really good about it. And it's going to make you a lot less stressed out. And when you have the money, Rosalie, you're going to be a lot more willing to go to the dentist and not put it off. I can't promise it's going to make the actual dental pain go away, although the dentists are good with the anesthesia these days. So ask for the anesthesia for sure if that's right for you. But it will actually, at least it'll take away the financial pain, and you won't be stressed out and worried about the money and how you're going to pay for everything. You can actually get the dental care that you need at the time you need it, because we don't want the pain to escalate, and we certainly don't want the financial consequences to escalate as well.
And there's pain on both ends, right, Bobby?
So true.
So, Bobby, share with our viewers where they can find more information.
You can get more information about the survey and more at dentallifetimeofcare.com. It's going to give you a lot more information that I promise will motivate you, and also the resources to help you get ready and plan and prepare, as you said so well, for any dental needs in the future. It's all about both dental wellness and financial wellness.
Thank you so much, Bobby, for joining us to advise our viewers with important dental health care information to help us financially prepare for future out-of-pocket dental care expenses.
Thank you.
Mentoring opens doors for students and job seekers with disabilities. Open the door to an all-inclusive workplace. Watch the upcoming episodes of Disability Mentoring and get involved in your community. Be a mentor. Everything continues to get more expensive. This is the time of year to educate yourself to a variety of healthcare insurance plans and resources to address your personal healthcare needs. Create a healthcare savings account so that you are prepared for an unexpected dental or medical procedure. Select a medical provider you trust to keep you healthy, and visit your doctor to discuss any changes in your health before you choose a 2024 healthcare plan to address those healthcare and prescription drug changes. Share your tips on how to educate yourself to determine the right healthcare plans to suit your needs and financial budget at facebook.com/Rose Lee Show. And follow us on Instagram at The Rose Lee Show. Watch this episode and many others 24/7 at RoseleeArcherShow.com. Thank you so much for joining us, and we look forward to seeing you soon.